So first and foremost, the word OBG, which stands for obstetrics and gynecology, the two different areas in the field of medicines are merged in this obstetrics and gynecology. Okay, we try to understand this. I think you are already aware. I know this, but still, it's my duty to inform you that the basic concept of obstetrics and gynecology. Okay, the word obstetric, it is a branch of medicine and surgery that deals with pregnancy, labor, and postnatal period. In simple, obstetric is nothing but uh, any matter which is related to pregnancy and related disorders will be dealt in the field or dealt in the field of obstetrics. Okay, and the age which is usually covered is 15 to 45 years, so which we call it as a fertile age of women. Okay, that's why the obstetrics usually the range which is given is 15 to 45 years. Okay, usually very rare question comes out of this. And gynecology is a branch of medicine and surgery that deals with the diseases of female reproductive organs. Please remember this: female reproductive organ, irrespective of their age. Okay, from birth to death. Okay, this is the range of age usually it is covered in the field of gynecology. Okay, obstetrics is only pertaining to the fertile period and which is related to their pregnancy, and its related issues will be dealt in obstetrics. Okay, but as simple as this, obstetrics and gynecology. Okay, please remember this. This is sometimes tricky. Sometimes, very rarely, they will ask the age which is covered in the obstetrics as well as the gynecology. Okay, fine. And in this basics, please remember most of the questions in the examination it is prepared in such a way that where the difficulty index will be designed. Okay, difficulty index in the sense the first 60% of the questions will be from the basics. Okay, then 20 questions will be just above normal basics, and another 20 deciding questions will be very tough and very deep questions will be asked. Okay, that's why to be in a competition, you should have the basics first. Those 60 you supposed to be ready. Okay, in that context, we are bringing the basics of this obstetrics and gynecology. Next, in this OPG, we said that female reproductive system is a major concern or a major focus area upon which all the diseases of the pregnancy is being discussed. Okay, to understand this, we need to know the female reproductive system and its components and structures. Okay, I think many questions we have seen that the questions are asked regarding the female reproductive organs. Okay, so again, female reproductive system is broadly divided into two. One is external reproductive organs and the internal reproductive organs. So external reproductive organs. So the other name, usually we call it as a ula, or it is called as a female pudendum. Okay, remember these terms. So whenever there is an alternate term, please remember when there are more than one name for an individual word, then it has a potentiality of asking in an MCQ. Okay, whenever you get an alternate term, please remember, note and underline that it can be asked in the examination. Okay, so let's see this in the external reproductive organs, which is comprising of mons pubis, labia majora, labia minora, the clitoris, vestibule, and the perineum. Okay, on the other side, we have internal reproductive organs starting from ovaries, the fallopian tubes, uterus, cervix, and vagina. Okay. So let us see in the next picture. You may be able to understand. It is an out. It is an just an outlook to brief you about the internal and external organs and its key functions. Just we have highlighted here. Okay. Same like external, what we organ just we said clitoris, so which helps in the sexual stimulation. The labia majora, which helps in protection, both labia majora and minora, and the vaginal opening, which is for the lubrication. Okay, I think we will discuss in detail about this. This is just an outlook, just to show you that which are the internal and the external organs of female reproductive organs. Okay, let us see in detail about this. I think this is external genital organs. Please remember the placement of the external reproductive organs. Okay. On your right side, you can see there's a labeling is clearly mentioning number one is the mons pubis, number two, which is marked as a clitoris. Okay. So, which we said it is for the sexual stimulation. Okay. The three, which is shown as the urethral opening, and the outer lip, inner lip, what we are calling it as a major lab, labia majora and minora. There is a urethral opening, there is a perineal space, and the anus, which is marked. Okay, on your left side, you can see that the additional, what you can see is the there are, I think, the extreme left, you can see there is an opening. Okay, that is the opening for the duct of skins gland. Please remember, these are important. The duct of skins is important, as well as the Bartholinian gland, the opening for the ducts of Bartholinian glands, which are there on your left side. Please see that these are important. Usually in the examination, we have seen many times it is asked. Okay, that's why I put this separately to make you understand that usually in the examination they asked regarding the duct of
Sir,
skins
will you
gland.
please repeat it again?
Yes. So which one you want me to repeat?
That's of Bartholomew glands, sir.
Yeah, probably. Okay, okay, done. So in your extreme, I think I have some more slides to explain. Just I'm giving a clue that these are important. Okay,
Okay,
in the
sir.
external genital organ. So where in the extreme left side there is a picture. Hope you are able to see this. And there is a
Yes,
just I
sir.
have marked it. There is an opening for the left duct for the skin gland. Okay, this is important in the examination they will ask. I will explain this for why it is significant in reproductive organs. Okay, even the opening for the Bartholin glands. Okay, so these are the key secretions or glands which secretes the vaginal secretions, which are key in terms of fertilization. Okay, I will tell you why it is important in the further slides. Okay, just see the placement. This is the placement where usually they don't ask regarding the structure and labeling, but however, to understand the concepts, you should know these labels. Okay, we'll go one by one in this slide. One is the mons pubis. So it is also otherwise called as a mons veneris. It is a pad of adipose connective tissues lying in front of the pubis. In adult, it is covered with the hairs. Okay, I think very less questions asked regarding mons pubis, but however, you just remember the name. Okay, then the labia majora. So this is otherwise called as the outer lip. So thick elevated fold. Just wait. Somebody is waiting. Just wait. Yes, fine. I think one voice talking. Please unmute your voice.
నువ్వు
Okay.
తీసుకుంటేనే తినకమ్మా
Major,
నీకు
labia minor. So this is
వాంట్ ఈట్
okay. Please, whoever is talking, please mute yourself. If you have any query, you can enter. Right. So the clitoris, usually the questions related to the clitoris is asked in the exam. Okay, this clitoris, which is of 2.5 centimeter length, which is a rich supply of nerves and erectile tissue, which is present in the external genitalia, which is homologous with the glans penis in male. So many times this question is asked regarding clitoris, and here you should understand the term homologous. Okay, homologous is nothing but homologous is nothing but see the term homologous, and we use two terms.
డైలీ
One
త్రీ
is
క్లాస్
homologous and analogous.
50
Here the homologous.
ఇది కాదు ఇది తినండి
Okay. Okay.
న్యూట్రీ చాయిస్ అట్లా
Okay. Okay. Wait. Just I will try to mute.
జ్యూస్లు అయిపోయినావా
Sorry. So just I was talking about the concept of homologous and the analogous. These two terms usually in the examination will find out this. Okay, homologous is nothing but, so when the after the fertilization, I think the cells will undergo the mitotic divisions. After the mitotic divisions, I think cell divisions will be taking place, right? After every cell division, these layers will be differentiating. Okay, the layers will be differentiating, and this homologous in that context is every layer, sorry, the organ which is originating from the similar kind of cells, but doing some different characteristics, or else different functions, originating from the same kind of cells but doing some different functions. Okay, so in female it is doing a different function, and in a male it is doing a different function. That is the meaning of homologous. Okay, whereas analogous means the formation of an organ or a tissue from the same kind of cells, okay, but doing different functions. Okay, homologous is same kind of tissues originating from the same differential layers but doing some different functions. Okay, so that is a difference. I think I have a slide on this homologous and the heterologous, but most commonly we have seen this question in the examination papers. Okay, many a times, please underline this: the homologous of clitoris is glans penis in male. Okay, fine. Okay, next to see the next external genital organ is vestibule. Vestibule is another triangular structure which has four openings. Okay, which has four openings. One is the urethral opening, then the vaginal opening, the opening for the Bartholin ducts, and the opening for the duct of skins. Okay, this is an important vestibule and its openings. They also often ask these questions. Okay, and here we are talking about the Bartholin glands. Okay, so these are, please pay attention. This is important, both Bartholin and the skin glands. Okay, so Bartholin glands, which are alkaline, uh, which has a secretion which is alkaline in nature. Okay, where the pH of the secretion is above 7. Okay, the pH of the Bartholin gland secretion is above 7 pH. Okay, which helps in the fertilization and also acts as a lubrication in the vagina, and the secretion increases with the sexual excitement. Okay, similarly, we have skin glands is also almost having the same function, but only the placement is different. So it is paraurethral gland, just adjacent to the urethral opening. You can see the skin's glands. Okay, so these also have the secretions which are alkaline in nature. Okay, and remember why this alkaline I'm talking more is usually the normal flora of vagina which is acidic in nature. Okay, usually it is acidic in nature, but at the time of sexual excitement, both the Bartholin glands and the spleen glands will secrete the secretions which converts the vaginal acidic component to the alkaline component. Okay, if the content is acidic, then the sperm will not survive in that environment, acidic environment. It will not survive in the acidic environment. Okay, if acidic environment is present, then the sperm will not survive. As a result, so there is no chance of fertilization. Okay, and the conception doesn't takes place. Okay, that's why Bartholin glands as well as the skin glands has the significance in the process of fertilization. Okay, as these two are alkaline in nature, which suppresses the acidic nature of the vagina. Okay, that is what you have to remember. Okay, and similarly in the last line we have one more is homologous with the prostate gland. This is also asked many times in the exam. Okay, which is the homologous organ for skin's gland of female in males. Okay, then your answer is supposed to be prostate glands. Okay, remember both for the clitoris as well as the skin's gland, they have asked these questions. Okay, the perineum, which has not much significance, where obstetrically it has a gap between the anus and the end of the uvula. So where we can see there is a gap which we see in between them. We call it as a perineum, which doesn't have much significance in external reproductive organs. Okay, hope it is clear. Then we will quickly move into get into the internal reproductive organs. These are very important. These are the internal reproductive organs. Okay, in the internal reproductive organs, we can see that there is an in this picture you can see there is an ovary, there is an fallopian tube, there is an uh, uterus, there is a cervix. Okay, so these are very important in terms of examination because many questions I have noticed in the examinations. Okay, so first let us start with vagina. So I think regarding vagina also so many questions, so many times we have seen the questions. Okay, so it is a fibromuscular sheath which is having the stratified squamous epithelium, which has a multiple layers of squamous epithelium tissues which are there in vagina, and it is a communication channel between cervix and uvula. That is the external genitalia. Okay, and its length is important point is note. The length is anteriorly is 7 centimeter, whereas posterior length is 9 meter, 9 centimeters. Okay, there is a difference of 2 centimeter from anterior to posterior. The posterior length is 2 centimeter greater than the anterior length of the vagina. This is something different. If there is something different, it can be asked in the examination. Okay. So then the angle of vagina to the body horizontal line. Okay, the angle of vagina to the body in the horizontal plane is 45 degree. Okay, and remember here also there is a number. Where there is a number, there is a chance of question. Okay, please note this. And whenever there are numbers are there, I usually recommend students to have this wherever you get the numbers, write it in a separate page, and you should read this. At least you should glance this just before the examination at least. Okay, sometimes you should make a separate what we say that the quick read. Usually we keep a quick read notebook or a last minute glance. Usually we write. Okay, there you're supposed to write these numbers so that you can able to remember this. Okay, next we move to the pH. Okay, so pH of the vagina is acidic in nature. Please note this. This is very very important. Okay, this is very very important. Multiple times they have asked this question. The pH of acidic, the pH of vagina is acidic. It is three ranging from 3.8 to 4.5. Okay, and in the I have clearly mentioned it is in the reproductive age. Remember this. Okay, here the question will be maybe before puberty and after menopause or during puberty. The question can be asked in three different ways. Okay, hope you're understanding what I'm telling. So after the puberty, the pH is 3.8 to 4.5. Okay, puberty in the sense reproductive age, what I mean to say. Okay, but before the reproductive or before the menarche, the pH of the vagina is neutral or slightly alkaline. Okay, it's neutral or slightly alkaline. Okay, even after the menopause also it is neutral or alkaline. Okay, that's why say this is little confusing. That's why they may ask the question. Okay, whether there is a confusion also, usually the evaluator try to ask the question where there is a confusion. Okay, so there are three things are there. One is before menarche, one is after menarche, one more is after menopause. Okay, with the pH during reproductive age could be 3.8 to 4.5 is the pH. Okay, which makes it as a acidic in nature. Okay, and there is a reason why it is acidic. Okay, this is also asked in the exam. Okay, the normal flora of vagina contains lactobacilli acidophilus, which is a kind of a commensal bacteria. Okay, which is a type of bacilli. Okay, commensal means these are the harmless microorganisms. Okay, we call pathogens and commensals. These are the terms we use. Pathogens means these are the organisms which cause diseases to the human body. Okay, whereas commensals which doesn't cause any diseases to the human beings. Okay, so this is a kind of that bacilli which is normally present in the vagina. Okay, it is called as lactobacilli acidophilus. It is otherwise called as, popularly called as daughter-line bacilli. Remember, daughter-line is more popular than the lactobacillus acidophilus. Okay, it is otherwise called as daughter-line bacilli, and these bacilli, which converts the glycogen which is stored in the vagina, and it will utilizes and converts that into lactic acid. Okay, lactic acid is present in vagina. As a result, the vaginal pH is acidic in nature. Okay, as simple as that. Okay, please remember the name Dodeline bacilli, which is responsible for acidic pH. Okay, in the vagina. Okay, fine. So this is very important. This slide is very important. Please remember. So the multiple questions can be asked out of this. Okay, starting from the length of the vagina can be asked, the pH of the vagina, both in pre-menarche stage or in reproductive age or in menopausal stage. Okay, and the reason for acidic nature, then you should remember in Toderlin bacilli. Okay, fine. Next is the uterus. This is another important area. Usually in the examination, it can be asked. Okay, the other names to represent uterus is medulla. So usually we call it as a medullaritis. So usually we use the term, and hystero. Hystero is another synonymous word we are using it. Okay, usually hysterosalpingography. That is the term we use. Okay, so these are the technical terms and alternate to uterus. Okay, and this is an hollow muscular pelvic organ which is in pyriform shape. Okay, or usually we call it the pear shaped. Please remember, the shape also can be asked in examination. The shape of the uterus is maybe asked. Okay, pyriform, please remember. Okay, and uterus is the one which provides the shelter to the fetus. Okay, here only after the implantation, the growth of the fetus until the expulsion, the fetus will take a shelter in the uterus. Okay, and it has three distinct parts. One is the corpus. Again, the corpus has fundus and body cavity, and it has a small thin. I think you can see here. The arrow mark I will show this. This here. This is the isthmus, and the lower part of the uterus can be called as the cervix. The three parts: corpus, isthmus, and the cervix. And the length is important. This also asked many a times. The length of the uterus is 7 centimeter. Is the length. The width is 5 centimeter and the thickness is 2.5. Okay, and it is 7.5 into 5 into 2.5 is the dimension of the uterus. Please remember this. This is also an important point, as well as the weight of the uterus. See, here the question is also non-pregnant and the pregnant. Okay, you should be able to differentiate the question what is being asked. Is it for the pregnant lady or non-pregnant lady? If it is for the non-pregnant lady, the weight of the uterus is 60 grams. Okay, if they ask you the range is 50 to 80 grams. Okay, if they ask specifically, you should remember it is 60 grams. Okay, and for a pregnant term, okay, in a term, okay, a term 38 weeks of gestation, the the weight of the uterus will be approximately 900 grams to 1 kg. Okay, 900 grams to 1 kg. Okay, please remember this are important. Okay, fine. Next is a position is another important question. Okay, the position of the uterus is anteverted and anteflexion position. Anteverted and anteflexion position. So in this, please, you have to remember the angle. You have to remember the angle of anteverted angle. Okay, the angle is 90 degree, and the angle is made between the uterus to the vagina. Okay, I have put three diagrams. In that, please check the lower diagram. please have a glance on the lower diagram. I think there are lines are there. I think here you can see this is a 90-degree which is formed between the vagina and the uterus. Okay, which is forming 90-degree at this point, and that's why it is called as the antiverted angle. Okay, and there is another angle called as anti-flexion. Okay, here the angle is taken between the uterus and the body of the uterus. And here you can see this is an angle which is made here, angle between the cervix and the body of the uterus. Okay, angle between the cervix and the body of the uterus, which is coming 120-degree. Okay, usually this can be asked in exam. The angle made in antiverted position is can be asked, and in the anti-flexion position also can be asked. Okay, please remember this: the antiverted and anti-flexion positions of the uterus. Okay, hope it is clear to you. So this is uterus is also an important topic. Please remember this, especially the shape, the size, the weight, and the position are important. Okay, in terms of uterus. Okay. On the other hand, of the uterus, there are some more points to remember is there is a peritoneum fold present between the uterus and the rectum. Okay, so that we call it as a recto-uterine pouch, which is otherwise called as the pouch of Douglas. It is also called as cul-de-sac. Cul-de-sac. Usually, we do a procedure called as cul-de-synthesis, where we will be through the cul-de-synthesis, we will try to detect if any ectopic pregnancies are there. Okay, this is also important. The pouch of Douglas is important from the point of examination. So, just I am bringing this. So here you can see there is a recto-uterine pouch which is mentioned in the diagram. So this is the place where the photosynthesis is done. Okay, the question can be asked: the uh, the the place at which the photosynthesis is done is maybe the question can be, and the answer could be the pouch of Douglas, or the option can be recto-uterine pouch. Okay. Then regarding the uterus, there are three different distinct layers are present in the uterus. The three distinct layers are present in the uterus, namely the outermost layer is called as a perimetrium, and the middlemost layer is called as myometrium, and the last, the innermost layer is called as the endometrium. Okay, which is in terms of pregnancy, it is called as deciduum. Okay. Anyway, in this, I think most important is from the point of examination, the myometrium. Okay, because again, myometrium has three distinct layers. Again, three distinct layers are present in the myometrium. Okay, so namely, again in this outer myometrium is made of longitudinal muscle fibers. The middle muscle layer, which is made up of figure of eight muscles, which is otherwise called as living ligature of the uterus, and which is arranged in a cis-crossing manner. The arrangement of the figure of eight muscles are made in cis-crossing manner, which is making a provision of living ligature. Living ligature means Uh, these are at the time of delivery. I think the uterine artery, which is passing through the myometrium after the expulsion of the fetus, I think it will clamp. Okay, by natural phenomena, as the uterine arteries are passing through the cis-crossed muscles. Okay, and the contract of these muscles will stop the bleeding. Okay, this is called as the leaving ligatures. Okay, please remember this term. Middle layer is made with figure of eight muscles, so which is otherwise called as the leaving ligature, and the arrangement of these muscles are in cis crossing fashion. Okay, that is what you're supposed to remember. Okay, and the last layer is endometrium. So innermost layer is endometrium. So usually at the time of pregnancy, this is called as the decidua. The other name of endometrium during pregnancy is decidua. Okay. Hope you're able to understand, or you need to tell in Telugu in between, or is it fine? Anyone can respond me.
Yes, sir. You తెలుగులో కూడా
Okay,
చెప్పండి సార్.
fine, only in English.
కొంచెం తెలుగులో చెప్పండి
Okay,
సార్.
Telugulo okay, నాకు వచ్చిన తెలుగులో చెప్తా. Pardon me if I tell something wrong in Telugu. Since I am from Karnataka, I know little Telugu, but I can uh, tell you. Okay, if you get any doubts, you can ask me in Telugu in between, so that I will try to explain if anything is important. Okay, right. మధ్య మధ్యలో మీరు అడగొచ్చు if you get any doubts.
సార్ మీ వాయిస్ చిన్నగా
Right,
వినిపిస్తుంది
next.
సార్.
వాయిస్ చిన్నగా అనిపిస్తుందా?
ఆ,
Okay, then
అవును
I'll try
సార్.
to speak louder. Just let me check. Okay, ఇప్పుడు
ఇప్పుడు ఓకే సార్.
ఇప్పుడు బెటర్
థ్యాంక్
ఉందా?
యూ సార్. ఉంది సార్. థ్యాంక్ యూ సార్.
Okay, okay, fine, fine. So next important is fallopian tube. Fallopian tube గురించి చాలాసార్లు అడిగారు. So the other names of fallopian tube is salpinges, okay, or it is also called as oviduct. It is otherwise called as Mullerian duct. Okay, ఇట్లా మూడు పేర్లు ఉన్నావంటే ఒక క్వశ్చన్ రావచ్చు అని అర్థం. ఓకే, ఎప్పుడైనా కానీ if there are multiple names, synonymous names, ఓకే, వేరే వేరే పేర్లు ఉంటే డెఫినెట్లీ ఎగ్జామ్లో అడిగే ఛాన్సెస్ ఎక్కువ ఉంటుంది. ఓకే, సో ఇన్ దిస్ ద పార్ట్స్ ఇఫ్ యూ సీ the parts of the fallopian tube starting from the middle is interstitial, or it is called as the intramural, which has the length of 1.25 centimeters, and it has a diameter of 1 mm. That is the diameter is for the overall circle. Okay, the next part is isthmus. I think you can also see this in diagram lo chudochu. It is labeled clearly where is the isthmus. Okay, and the next part is ampulla. This is 5 centimeters, and many a times they have asked this question, chances are అడిగారు. So where is the point at which the fertilization takes place? Okay, in that case your answer is supposed to be ampulla. Okay, many times they have asked this, please remember and note this. Okay, the last one what we have is the infundibulum, which is 1.5 centimeter, and which has a diameter of 6 mm. Okay, and in this, please remember this last uh, term, that is, it has a finger-like projections which are called as fimbriae, and the largest fimbriae is the ovarian fimbriae. Okay, this is the one which collects the ovum from the ovary. ఓవర్ నుంచి రిలీజ్ అయిన ఓవంని కలెక్ట్ చేసుకునే ఫింబ్రియే పేరు ovarian fimbriae, and which is the longest one. Okay, so this can be asked in examination. Okay, which name of fimbriae which is long, or which helps in collecting the ovum from the ovary. Okay, and remember these fallopian tubes which are having ciliated columnar epithelium. Ciliated means which has which has the structures, cilia, which propels the content from down to up. ఓకే, సో దీంట్లో స్పెషల్ సెల్స్ ఉంటవి. సెల్లో ఏముంటే సీలియా అని ఉంటుంది. సీలియా అంటే జస్ట్ లైక్ అవర్ hair like structures, and this has the tendency of pushing the things from moving. It helps in the movement. Okay, that's why the ovum which will be transported upward into the uterus, even the sperm also will move because of the presence of ciliated epitheliums. Okay, that is a key characteristics which is present in the fallopian tubes. Okay, please remember in this, the for the different parts, and the ampulla is supposed to remember, and ovarian fimbriae should be remembered. Okay, fine. Next we'll move on to the another important organ, internal organ, that is called as ovary, which is otherwise called as the female gonad. Okay, and this is also asked in exam. What is the primary function of ovary? Okay, and the primary function of ovary is to release the ovum. Okay, it prepares the ovum and it releases. Okay, and secondary function of the ovary is the release of the hormones, especially the estrogen and the progesterone. The estrogen and the progesterone, these are the two key hormones which are released from the ovaries. Okay, and the length is also important. There was length and weight of the ovary. They asked this a couple of time in the examination. The ovary length వచ్చేసి 3 centimeters, width 2 centimeters, and thickness is 1 centimeter. It is 3 into 2 into 1. Okay, whereas the uterus is 7.5 into 5 into 2.5. Okay, here ovary is 3 into 2 into 1. Okay, please remember this. This is asked on the weight of the ovary. Please see this. You can see it here. It is a 0.14 ounce. It is in ounce, not in terms of grams. Okay, please remember, in the grams it is 2 to 3 grams. Don't get confused with the. Wait a minute. Don't get confused with the units which are used. Okay, units గురించి కొంచెం uh, you should keep your mind regarding the units, what unit they used. Okay, the weight of the ovary, the weight is asked couple of times. Please remember, it is 0.14 ounce. Okay, whereas in terms of grams it is 2 to 3 grams. Okay, that is the weight of the ovary. So there are some additional points in the terms of examination. Which is a primary sex organs they may ask in the examination. So in that you should say that ovary is the primary sex organs, whereas testis in males is the primary organ. Okay, please remember this. And secondary sexual organs, which are there in the female, usually the uterus, fallopian tube, the vagina, breast are the secondary sexual sex organs. Okay, and these secondary sex organs, sorry, the secondary sex organs, usually they ask the question which are the organs of primary sex organs, then they will give the option of all which are existing. Okay, then I should be remembering this. The ovary and the testis are the primary sex organs. Okay, both independently for both male and female. Okay, and the next I will talk regarding analogous and homologous in the next slide. Okay, I think regarding this puberty sequence is another term which is given by Tanner and Marshall. They have given a sequence. Please remember this sequence. I think in one of the question paper I have seen this. That's why I put this in this slide. Okay, what are the sequence of puberty? So after the menarche, so what before the menarche? So what are the changes that we see in a puberty changes from the differentiating from child to adolescence? Okay, and the sequence is outlined by Tanner and Marshall. Tanner and Marshall are the people who has given this. Okay, and the first one is telarchy. Is the first term used. Is a telarchy. Telarchy means the development of breast buds. The formation or the development of the breast buds is the first one to occur. Okay, that is called as the telarchy. Okay, telarchy followed by adrenarchy. Adrenarchy is nothing but development of axillary hairs. Development of the axillary hairs is the second stage. Okay, and the third stage which they have mentioned is pubarchy. Pubarchy is nothing but formation of pubic hairs on the mons pubis area. On the mons pubis area, there is a formation of pubic hairs, and this is referred as pubarchy. So pubarchy is the term which is used. Okay, and the fourth one is increase in height. Their height will be increased, and the last comes is the menarche. Okay, when the menarche is the where the regularization of the menstrual cycle. Okay, the regularization or the initiation of the menstrual cycle, we call it as the menarche. Okay, but remember the cycle, they can ask this in the examination. Okay, what is the sequence? They can ask the sequence, or they may ask you which is the early one to occur. Okay, which is the early stage of puberty, they may ask. Okay, or which is the last stage of puberty, or they may ask as per the Tanner and Marshall. Okay, So remember, it is a tap im, tap im. So tap im is a thing shortcut term. You can remember this puberty sequence outlined by Tanner and Marshall. Okay, fine. So this is what is the table you should remember is the homologous and the analogous. Okay, this I already told you. Homologous is nothing but the both the so here the organ sorry here the organs so which are originating from the same kind of germ layer. Okay, remember this. They have started from the same germ layer, but doing different work. Okay, okay. Both are originating from the same germ layer. Germ layer at the time of zygote. Okay, from zygote to marula to blastocyst. Okay, from blastocyst to the other embryonic layers. Okay, from those germinal layers. Okay, those germ layers. Though same kind of germ layer they are originate, but doing some different works. Okay, whereas the ovaries as well as the ovaries homologous is testis. Okay, both originate from the gonadal ridge and produce the gametes. Both ovum and the sperm both are different. Okay, that's why they are though they originate from the same germ cells but having different function. Okay, the labia majora, the homologous is scrotum. Okay, please remember this table and the names. Okay, so for the labia minora, the homologous is penile urethra, and for the clitoris, it is glans penis, and the skinous gland, it is prostate gland, Bartholin glands, it is Cowper's gland, fallopian tube, it is vas deferens, and uterus, it is seminal vesicles. For the ova, it is sperm. For the vagina, it is ejaculatory duct. Okay, please remember this table. It will be very helpful because in the recent past, many questions related to homologous or analogous questions. Okay, especially in terms of OBG, they are asking these questions. Okay, please try to note down this. And more commonly, what I have noticed is regarding clitoris, they have asked many a times, and the skinny gland they have asked many a times, and the one more is fallopian tube. These are the three which I have gone through. Okay, many question papers I have seen these three things. So where the questions are asked. Okay, clitoris, skin gland, and the fallopian tube, and its homologous or analogous to be remembered. Okay, hope it is clear to you. Please remember and note down this table. This is important. Okay, if you don't remember another two also is fine. At least first two, which male organ corresponds to the female organ. Okay, that at least you can remember. Okay, fine. Hope it is clear to you.
Yes, sir.
By the time you just take a note, I will take 2 minutes break. Just I will come back. Some little work is there. Give me 2 minutes. Yeah, hope I came in within 2 minutes. Are you all there?
Yes,
Are you all
sir.
there?
Yes, sir.
Okay, good, good. Hope nobody is sleeping or busy in eating budgies, biryanis.
No, sir.
No, sir.
No, sir.
Okay, good. That's fine. Okay, shall we continue? Hope I didn't
Yes.
distract your mind towards
Yes, sir.
budgies. Huh? Now you don't ask your husband to prepare budgies now. Oh, you said you many of you are not married. Sorry. Okay, fine. Next is this is another important phenomena to understand in OBG, that is menstrual cycle. This is also very key, because based on this, the further concepts will be clear to you. Okay, this is a definition. It is not much so important regarding the definition. It is a visible manifestation of cyclic physiological uterine bleeding due to shedding of endometrium, outflow through vagina, followed by invisible interplay of hormones, mainly hypothalamus, pituitary, and ovary axis. Okay. Out of this definition, important is what is the role of HPO axis. Please remember this. They asked this. HPO axis. What is the importance of HPO? HPO stands for hypothalamus, pituitary, and ovary axis. Okay, this is the one which is controlling the menstrual cycle. Okay, I will tell you what is this HPO in the last line. Okay, before that, the average age of menarche is 13 years, which you should remember. The average cycle days, usually the common one, we are taking average because every individual is different. Though we are going with the common, but the average cycle is 28 days. Okay, this is sometimes rarely they ask it. Okay, where something it is it is asked. I think somewhere I asked it, not in this competitive exam. In some quiz, they asked this question. Okay, in a year there are 13 menses. Usually, if you take into consideration per year, there could be 13 menses per year, and the reproductive age, if you consider from 15 to 45 years, is almost 30 years. And every year, if you think of 13 menses, the the number of menses during a reproductive age could be 390. So I think it is asked in some quiz competition. So we can also expect, we don't know in the examination what is the average number of menses during a reproductive age, unless they are conceived. If they are conceived, or if they otherwise, the average number is 390. Okay, and the bleeding, this is also sometimes asked what is the average bleeding takes place. Okay, and the average, if single number to take, it is 35 ml. If the range is asked, it could be from 20 to 80. Okay, and remember, range is from minimum to maximum. It is from minimum to maximum under normalcy. Okay, in a normal adolescent girl, the range is from 20 to 80 ml. Okay, we are not talking about abnormal. Please remember. Okay, in a normal case, the minimum is 20 ml and the maximum is 80, and the average is 35 ml. Okay, please remember. Usually, average they will ask. Okay, please underline that average for 35 ml. Okay, and now we shall understand what is this HPO axis. Okay, hypothalamus, the pituitary, and the ovary. How they are how they are acting together, or coordinating together in control of menstrual cycle. Okay, first is the hypothalamus, which is releasing the gonadotropin releasing hormone. Okay, gonadotropin releasing hormone. These are the hormones which are helpful in the maturation of the gonads. Okay, both the ovary, especially here. Okay, this gonadotropin releasing hormone will stimulate the anterior pituitary, and from the anterior pituitary, we have almost six different types of hormones which are released from the anterior pituitary. Okay, so among them is FSH, the follicular stimulating hormone, luteinizing hormone. Even we have other growth hormones. Okay, ACTH. We have prolactin. Likewise, we have different hormones. But among this, what we wanted to know is FSH and luteinizing hormone. Okay, so follicular stimulating hormone as well as the luteinizing hormone, which acts upon the ovary. Okay, for these are helpful in the maturation of the follicles. Okay, follicles, these are the follicles, we call it these are the primary follicles maturing into Graafian follicles. Okay, once they are matured, again it releases the ovum. Okay, so this FSH and the luteinizing hormone or helps acting on the ovary for the maturation of the follicles, and then it releases the estrogen and progesterone from the ovary. Okay, so that is what we called it as a HPO axis. Okay, I think in this we try to understand what are the different phases of menstrual cycle and the influence of hormones. Because this is very very important. Please remember. Okay, these menstrual cycles. I think we have phases of. So this is first confusion usually they will have is the phases of menstrual cycle. Okay, in every book you will find it in two different areas where the changes or phases are classified. One is ovarian changes, one more is uterine changes. Okay, what changes happens in the ovary? Ovary la ఏమేం చేంజెస్ అవుతుంది, మళ్ళా యూట్రస్ లో ఏమేం చేంజెస్ అవుతుంది, దాని గురించి రెండు రకాల ఫేజెస్ ఉంటుంది. ఓకే, సో వన్ వాట్ వి కాల్ ఇస్ ఓవరియన్ చేంజెస్. ఓకే, ఓవరీలో ఏం చేంజెస్ అవుతుంది? So according to that, we have two phases. One is follicular phase and the luteal phase. On the top of this diagram, you can see this. Okay, one is the follicular phase. Follicles means is the follicles, Graafian ovarian follicles, which is maturing into Graafian follicle. Then it releases the ovum. Then it will become a corpus luteum. Okay, so these changes which are happening in the ovary, we have two phases. One is follicular phase, one more is luteal phase. Okay, follicular is related to follicle, luteal is once the ovum is released, what the corpus luteum is remaining, and that is the next phase, what we call it as a luteal phase. Okay, and we also have the changes which are happening in the uterus. In the bottom of the diagram you can see this, bottom of the diagram you can see this, and it is classified into three different stages. Okay, one is the breeding phase, second one is proliferative phase, and the last one is secretory phase. Okay, so this we will discuss in detail in according to this what happens in these stages. Okay, please pay attention and understand, try to understand this. Okay, I think in this slide you can understand that what changes happens in the ovary. Okay, so ovary which is having the follicles, millions of follicles are present in the ovary, in each ovary. Okay, and in this first stage is follicular phase. For the first 14 days we call it as a follicular phase. Okay, so follicular stimulating hormone, you remember this follicular from the anterior pituitary. From the anterior pituitary, follicular stimulating hormone has reached the ovary and it is affecting on every follicle. Okay, among the lakhs of follicles present in the ovary, only one dominant follicle will grow. Okay, so every, I think at the time of puberty there are 2 lakhs of ఫాలికల్స్ ప్రెసెంట్ ఇన్ ద ఓవరీ. 2 లక్షల ఫాలికల్స్ ఉంటే ఒక్కటి మాత్రం డామినెంట్ ఫాలికల్ ఉంటుంది దాంట్లో. ఎవ్రీ టైమ్ వన్ విల్ బి డామినెంట్. ఓకే, సో దట్ విల్ బి గ్రోయింగ్, దట్ follicle will be releasing the estrogen and the progesterone. Okay, this usually we call it the Graafian follicle. Okay, and these grown follicles will be releasing estrogen. ఓకే, ఈ ఫాలికల్స్ ఏముంటుంది, అవి ఈస్ట్రోజన్ రిలీజ్ చేస్తుంది. సో దిస్ విల్, యాజ్ ద అమౌంట్ ఆఫ్ ఈస్ట్రోజన్ ఇస్ ఇంక్రీస్డ్, ఓకే, ద ఫాలికులర్ స్టిమ్యులేటింగ్ హార్మోన్ విల్ బి decreased. As the follicular stimulating hormone will be suppressed. Okay, and it will stimulate the luteinizing hormone. Okay, luteinizing hormone ఎక్కువ అవుతుంది, follicular stimulating hormone తక్కువ అవుతుంది. Okay, a mature follicle later will be ruptured from the Graafian follicle and releases the ovum. Okay, that is called as the ovulation. Okay, please remember this: rise of LH, suppression of FSH. These two you should remember at the time of ovulation. Okay, I think in the graph also you can see this, the hormones. I think here LH is very high. Okay, at the time of ovulation, it is because of upsurge of luteinizing hormone. Please underline and note this point. At the time of increased luteinized hormone, the ovulation will takes place. Okay, at the same time, the FSH will gradually decrease. Okay, fine. And remaining ovulation will takes place, and the remaining part of the follicle will be remained as the corpus luteum. Okay, and from then the luteum, the beginning of the luteal phase. Okay, I try to repeat this in a simple way. So in the follicular phase, what happens is follicular stimulating హార్మోన్ ఉంటుంది పిట్యూటరీ నుంచి పిట్యూటరీ నుంచి రిలీజ్ అయింటది ఫాలిక్యులర్ స్టిమ్యులేటింగ్ హార్మోన్. సో దీని నుంచి ఏమవుతుంది, ఫాలికల్స్ బాగా గ్రోత్ అవుతుంది. ఓకే, దాంట్లో ఒకటి ప్రిడామినెంట్గా గ్రోత్ అవుతుంది. ఓకే, ఈ ఫాలికల్స్ నుంచి ఈస్ట్రోజన్ ప్రొడక్షన్ అవుతుంది. ఓకే, ప్రొడక్షన్ లెవెల్, ఈస్ట్రోజన్ లెవెల్ ఎప్పుడు ఎక్కువ అవుతుందో అప్పుడు ఎఫ్ఎస్హెచ్ తగ్గిపోతుంది. దిస్ ఈజ్ వి కాల్ ద నెగటివ్ ఫీడ్బ్యాక్ మెకానిజం. ఓకే, నెగటివ్ ఫీడ్బ్యాక్ మెకానిజం. Just give me a minute. I'm getting an important call. 1 minute, please. Yeah, sorry. So what I was trying to tell is that, so follicular stimulating హార్మోన్స్ నుంచి ఫాలికల్స్ గ్రోత్ అవుతుంది. ఫాలికల్ గ్రోత్ అయినప్పుడు ఈస్ట్రోజన్ రిలీజ్ అవుతుంది. ఈస్ట్రోజన్ లెవెల్ ఎక్కువైనప్పుడు ఎఫ్ఎస్హెచ్ తగ్గిపోతుంది. ఎఫ్ఎస్హెచ్ తగ్గినప్పుడు ల్యూటినైజింగ్ హార్మోన్ అప్సర్జ్ అవుతుంది. ఓకే, ల్యూటినైజింగ్ హార్మోన్ అప్సర్జ్ అయినప్పుడు ఫాలికల్స్ రప్చర్ అవుతుంది. యాజ్ ఎ రప్చర్, the ovum will be released. Okay, and the remaining part of the follicle will continue as a corpus luteum. Okay, and the remaining part will be the second phase, what we are calling it as a luteal phase. Okay, and this luteal phase is constant for 14 days. If the corpus luteum, so which is also releasing estrogen and progesterone. Okay, and these estrogen and progesterone will act as a tocolytic agent. Tocolytic agent means, so which is the one which prevents the contraction of the uterus. Okay, that is the meaning of tocolytic. Okay, so tocolytic agent, and if it is pregnancy is confirmed, this will be continued. Okay, this uh, the continuation of secretion of progesterone especially will be continued. Okay, up to 3 months. Okay, if not fertilized. Okay, fertilize ayledante, what happens is corpus luteum, so which will be, the beginning part is corpus luteum menstrualis, which will be converted into corpus albicans, and which will disappear in 28 days. Okay, again it will disappear. Okay, and when it disappears, again bleeding phase will start. Okay, so if fertilized, what happens is this corpus luteum will remain as a corpus luteum verum. This is the term, corpus luteum verum, and it will remain as it is for up to 3 months. Okay, and it will continue releasing the progesterone. Okay, this corpus luteum will be released through the corpus luteum. Okay, and the presence of progesterone will inhibit the shedding of the decidua. Okay, will inhibit the shedding of the decidua, and the pregnancy will continue. Okay, and up to 3 months. Okay, after 3 months, the placenta will be developed completely, and placenta will continue releasing the progesterone. Okay, remember progesterone is the one we should remember in the second phase. Okay, the luteal phase. Okay, because of that only the shedding will not takes place. Okay, if the corpus luteum which converts into corpus albicans, then when it disappears, the progesterone level will come down. As a result, the shedding takes place. Okay, so that is what you should remember in the that is what you should remember the ovarian changes during the menstrual cycle. Okay, so on the right side you can see, so there are some special information is there. I think this is asked in the examination. Okay, one is follicles at the fetal life itself will be there. At 20 weeks of gestation there will be 3 million follicles will be present. Okay, that is 3.5 millions in each ovary just before the birth. Okay, and at birth I think there will be 2 million cells, that is 1 million in each ovary. Okay, then at puberty 4 lakh cells, that is 2 lakhs in each side follicles will be there, and out of these 2 lakhs, 4 lakhs only one follicle will be matured, and that matured will release one ovum. Okay, and at menopause there will be less than 10,000 follicles will be present in the ovary. Okay, this is an additional information, but sometimes they can ask this in the examination. Okay, please remember and note. Okay, but question is related to the fetal life. They will ask whether the follicles will be present at follicle life or not. That is a question usually they ask in the examination. Hope it is clear. Then we'll move to the uterine changes during menstrual cycle. Okay, uterine changes during the menstrual. What changes happens in the uterus? Okay, and the first phase in this, the first phase will be bleeding phase. Bleeding phase, otherwise called as ketamania. Okay, ketamania, and the duration of this phase is 1 to 5 days. 1 to 5 days is the duration for this bleeding phase. Okay, so in this corpus luteum which will disappear, you just remember in the luteal phase what happens is, if it doesn't fertilized. Okay, so corpus luteum became corpus albicans, then it disappears. Okay, so now it is the end of that stage where the corpus luteum disappears. So when it is disappearing, the estrogen and progesterone level will decrease. Okay, estrogen and progesterone level will be decreased. Okay, and especially estrogen acts as a vasodilator also. Okay, when the level of estrogen is less, then the vasoconstriction will takes place. Okay, so vasoconstriction will lead to hypoxia and ischemia, and there is a irreversible necrosis will takes place. Okay, and when the endometrial cells are dead, there is a bleeding will takes place. Okay, and when there is a bleeding, again the hypothalamus gets a stimulation to release the oxytocin from the posterior pituitary. Okay, and the uterine contraction will begin, and the expulsion of blood takes place through the vagina. Okay, this is as simple as this. When the progesterone level is less, okay, estrogen and progesterone levels are less. Okay, what happens is the vasoconstriction will takes place. As a result, ischemia, and there is a shedding of the, or the bleeding will takes place, and this bleeding in turn stimulate the posterior pituitary to release the oxytocin. Hence the contraction will takes place from the uterus, and there will be a shedding of blood through the vagina, takes place. Okay, there is a bleeding phase. It happens for 1 to 5 days. Okay, and once the shedding is done, the next stage is proliferation phase. Proliferation is again rebuilding phase. Okay, it takes place from 6 days to 14 days. Okay, in the proliferation stage, what happens is again FSH, follicular stimulating hormone. You remember the first stage. Okay, where the FSH will be released and it will mature the follicles, and the follicles will be releasing the estrogen. Okay, and this estrogen and the progesterone both will be increasing the endometrium by means of hyperplasia and hypertrophy mechanism. Okay, estrogen has multiple roles. One is vasodilation as well as hyperplasia. Okay, and hypertrophy by the progesterone. Okay, so that is the rebuilding stage which happens in the uterus. That is proliferation phase from 6 to 14 days. Okay, and the next is secretory phase. Secretory phase, otherwise called as a preparatory phase. Okay, it happens from 15 to 28 days, where the corpus luteum secretes estrogen and progesterone. Okay, where the hyperplasia and hypertrophy, uh, hyperplasia by the estrogen and hypertrophy by the progesterone, which will be taking place. Okay, where the uh, where the where the endometrium will be, the layers of the endometrium which will be reaching up to 5 centimeter. Okay, it can grow up to 5 of centimeter at the end of secretory phase. Okay, as the corpus luteum convert into albicans and disappears, then the bleeding phase will start again. Okay, so that is the continuation: bleeding phase, proliferatory phase, and the secretory phase. Okay, so these are the stages. Please remember, one in the ovaries, then in the uterus. Okay, these two are important. Hope it is clear to you.
Yes, sir.
Okay, next we shall see the fertilization. This is another important concept to understand. Fertilization, as the name it says, it is the union of both the male and the female gametes. Okay, the meet of the male and the female gametes to form the zygote in the fallopian tube. That process we call it as a fertilization. Okay, please remember the steps. First is the ovulation in the female genital organ. The ovulation, the ovary, which is releases the mature ovum into the fallopian tube. That is the first part you should remember. As soon as the ovum is released, it will be caught by the ovarian fimbriae, and it will get into the fallopian tube. In the fallopian tube, there are ciliated columnar epithelium which will be pushing the ovum upside. Okay. Next is the sperm journey. Okay, sperm which travels through the female reproductive tract. Say, after the process of ejaculation, after the process of ejaculation, the sperm which will be traveling into the female genital tract, especially through the vagina. Okay, and these pumps will be moving towards the fallopian tubes. Okay, and in the meanwhile, the journey, the sperm will be having the process called as capacitation. Please remember this word, capacitation.
Received
So,
Paytm
okay,
payment of
when the sperm is there in the
130
semen.
rupees.
Okay, in the men semen, in the semen there will be sperm. Okay, but the sperm which is there in the semen is not that much matured enough to get into the ovum. Okay, when the sperm mixes with the vaginal secretions, okay, it will get more, what you say, it get more matured. Okay, and that process of maturation we call it as a capacitation. Okay, when it mixes with the vaginal secretions, then it gets the capacitation. Okay, so then it move faster to penetrate the ovum. Okay, then the next step is the sperm meeting the egg. The sperm attaches the ovum outer layer, that is outer layer of the ovum we call it as a zona pellucida, which is containing an hyaluronic acid. Please remember this. The zona pellucida is the outermost layer of the ovum, and this will be containing the hyaluronic acid. Okay, so this is can be asked in the examination. Okay, then comes the penetration. So uh, hundreds of there are hundreds of sperms which have entered there. Hundreds of sperms will be trying to enter into the ovum. Okay, but out of which only one sperm can enter it. Okay, here that is also possible by the sperm releases an enzyme to break through the egg protective layer. Okay, so there are two different enzymes are there to remember here. One is acrosin. One is acrosin is an enzyme, please remember this, which is a proteolytic enzyme. This will break the protein layer made by the zona pellucida. ఓకే, జోనా పెలిసిడాకి ఒక ప్రోటీన్ లేయర్ ఉంటుంది. ఆ ప్రోటీన్ లేయర్ ని బ్రేక్ చేయడానికి ఈ అక్రోసిన్ ఎంజైమ్ ఉంటుంది. ఎక్కడంటే సో దర్ ఇస్ సో ఆన్ ద టాప్ ఆఫ్ ద sperm. Okay, so this will be there, and there is also another enzyme called as hyaluronidase enzyme. Okay, in the beginning I told you there is an acid. Okay, hyaluronic acid, and to break that acid this hyaluronidase enzyme is required. Okay, by this acrosin as well as hyaluronidase enzyme, so this can break or penetrate into the ovum. Okay, then the sperm enters into the ovum and their members are membranes are merged. Okay, and remember only one sperm only can get into the ovum. Okay, and once it is entered it blocks. Okay, please, this is an highlighting point, remember, blocking the other sperms. Okay, once the sperm enters the ovum, blocks the other sperms from entering. Okay, so once the sperm enters into the ovum, the intracytoplasmic calcium level will be increased. Please note this. Intracytoplasmic calcium level will be increased. As a result, it blocks the entry of other sperms, and this phenomena is called as Ullema block. So you can remember, this is an point to remember, Ullema block. It is also called as zona hardening. It is also called as zona reaction. Okay, usually most popular term is Ullema block. Remember this Ullema block is the one. It is mainly because of increased cytoplasmic calcium in the ovum. Okay, as a result the layer will be blocked and the further sperms will not get into the ovum. Okay, so once it is entered, then the formation of a zygote, that's the last stage. The egg and sperm combines their DNA to form a zygote with the 46 chromosomes. So till then, both the sperm and the ovum both are haploid in nature. Okay, haploid is nothing but 23 chromosomes only. Okay, 22 autosomes, one sex chromosome. Okay, when they merge together, ovum is 23, even sperm is 23. Together it will become diploid cell. Okay, earlier it is haploid cell, now they become diploid cell. Okay, after the union of both the male and female gamete, okay, what the product is formed is called as a zygote, which is a diploid in nature, which will be having 46 chromosomes. Okay, this is just a summary of this fertilization process. You can see in this diagram, so where the Graafian follicle, you can see here Graafian follicle, which is there in the cell. Okay, when it matures it releases the ovum. The ovum get into the fimbriae and it is passing through the fallopian tube. Okay, so this is a place where the ampulla is a place where the fertilization usually takes place, where the sperm getting into the ovum. Okay, among many, only one will be getting into the ovum. Okay, then the process what will go on is the 2 cell stage, then to the 4 cell stage, then to the so 4 to 8, 8 to 16. Okay, so 16 stage, once it is reaching morula stage, and outer layer which will be the outermost layer which will be dissolved. Okay, then the nidation will takes place, that is the implantation. Okay, then the implantation takes place, then the differentiation of the layers will be taking place. Okay, one layer will become uh, trophoectoderma, which forms the placenta and the inner cell mass. Okay, other cells will be converted into cell mass. Okay, this is just an outlook of the process of fertilization. Okay, let us understand some more fundamental principles of this reproduction. One is the gametogenesis. This is just a basic concepts, just for your information. Okay, gametogenesis is the process where the ovum as well as the sperm will formation of sperm and the ovum. That is what we call it as a gametogenesis. Is a common term both for male and females. Okay, and when they are formed, they are haploid in cells. Okay, they are haploid cells once it is formed. Okay, but however, the basics form, we call it as germ cell. Okay, before the formation of the sperm cells, usually it comes from the germ cells, which we call it as a spermatogonia. Okay, which undergoes two types of division. One is mitotic division, one is meiotic division. Okay, in the mitotic division, what happens is the cell numbers will be same. One cell will become another cell, but the chromosome numbers will remain same in the mitotic divisions. Okay, whereas meiotic division, in the first, in that meiotic two divisions we see, in first is first meiotic division, another one is second meiotic division. In the first meiotic division, the cell, the chromosome numbers will be half. If it is 46, it will become 23. Got it? Again, this cell, when it undergoes secondary meiotic division, the cell numbers will remain same. Hope this is clear to you. The germ cells, when they undergo mitotic division, there are multiple cells will be formed, and these cells, when they undergo first meiotic division, will become half of the chromosomes will be there in every cell. Okay, when they go to the secondary meiotic division, again it will retain the same number of cells. Okay, as simple as it is written, 2n after mitotic division. Okay, then first meiotic division, it will become only n. Okay, after secondary meiotic division, it will become only n. Okay, if suppose example of 2n, we can take it as 46. After mitotic division, the cell, the germs cells will be having 46 chromosomes. Okay, after first meiotic division, the cell number will become half, that is 23. Okay, in the next meiotic division, it is not going to half, it will be same, that is 23. Okay, that is as simple as that. This ovum and the sperms will be undergoing these phases. Okay, please remember this basic structure. The diploid cells will become haploid. Again, haploid will remain haploid only. Okay, the first division, first is mitotic division, then is first meiotic division, then the second meiotic divisions. Okay, in the end, what we get is the haploid cell, which will be having 23 chromosomes in each male and female gametes. Okay, please remember this basic principle. Okay, some more points to remember in this process of fertilization is fertilization is the fusion of male and female. This we already said. It usually takes place at ampulla of fallopian tube. This is, you should remember, this is asked many times. So fertilized ovum is called as zygote. Zygote is a single cell, is a single size cell, but having diploid number of chromosomes. Okay, please remember this. It is a single cell, but having the diploid chromosomes. Okay. Next is the lifespan of ovum. This is also to be remembered. It is 12 to 24 hours only. Okay, the lifespan of an ovum is 12 to 24 hours, whereas the lifespan of the sperm is 48 hours to 72 hours. That is 2 days to 3 days. Up to 3 days is the lifespan of the sperm. Okay, implantation, it occurs in the endometrium on the sixth day. Usually on the sixth day, the the zygote is going to implant. Zygote actually, after multiplication, it will become blastocyst. That blastocyst is going to be implanted in the uterus. Okay, and the most common place of implantation is the upper posterior wall of the uterus. Okay, this is usually asked. Okay, the most common site for implantation is the upper posterior wall of the uterus, usually on the sixth day, as the sixth day of the fertilization. In terms of menstrual cycle, we can say it is the 20th day of the menstrual cycle, starting from the bleeding phase. Okay. And the next is decidua, the endometrium of pregnant uterus, chiefly influenced by the progesterone. Okay, decidua, the endometrium of the pregnant uterus, which is mainly influenced by the progesterone. Okay, that is what is supposed to remember. Okay, and I think before we go to the some one more point, just I forgot to tell you is, I think they may ask the questions to you related, which is the smallest cell of the human body. They may ask the question. Okay, what is the smallest cell of human body?
Over.
It's supposed to be ovum. Sure. No, no. I asked smallest one. You are telling the largest one. Okay, the smallest one and the largest one. You should remember. So the question is asked in different dimensions. Okay. So when a question is asked in general, you should talk in general. Okay. For example, the smallest cell in human body is sperm. Okay, but the same sperm may not be present in female. Got it? Okay, when the question is specific, that which is the smallest cell in females, then you can't write the answer of sperms. Got it? Then the next smallest will be the platelets. Okay, platelets will be the smallest cells in the females. Okay, but if the question is general, which is the smallest cell in human body, then you should say that sperms are the smallest cells in the human body. Okay, similarly, the largest cells in the human body is ovum. Okay, whereas the ovum cannot be present in males. Okay, so then the question could be, which is the largest cell in the male? Then your answer could be the neuron is the largest cell in the males. Okay, so that's how you should just understand the question what is being asked. Okay, I think with this we will stop this discussion. Just we will discuss few questions. Okay, take a break of 2 minutes, so that after 2 minutes we will continue the question and answers. Okay, I think almost 10-15 questions are there, we will discuss, and we will see if any doubts are present. Okay, take a break, drink some water, and come back for a question and answer session. Okay, are you all there?
Yes, sir.
Okay, shall we begin the question and answer? Let me
Yes,
see
sir.
how much you understood. Let me see how much you understood the topic. Okay. Okay, here is the first question. It's like this. So, vaginal canal normally has option A is an acidic environment, an alkaline environment, a neutral environment, an environment difficult to determine. Tell me what is your
Acidic
answer?
environment, sir.
Acidic
Acidic
environment.
environment.
Acidic environment,
Acidic
sir.
environment.
Okay, very good. Well, if the same question, if I ask you what is a vaginal canal normally has for a pre-puberty female, what will be your answer?
Acidic environment only, sir.
It's alkaline, sir.
Alkaline. Okay. Anybody else want to guess?
Neutral, sir.
Any two can guess. C and D also you can tell. Anyway, already you said one is A, one is B, one is acidic, one is alkaline. But none of you told the correct answer.
Neutral, sir.
Pardon?
Neutral,
Neutral, sir.
Neutral. Okay. Anyone want to try with D?
No, sir.
No. Okay. But the correct answer is see, in that case it is neutral. See, I told you in the beginning, only during only during reproductive ages only it is acidic. Okay, otherwise it is neutral in nature. Please remember this. Okay, so I told you in the beginning itself, pre-puberty I asked, pre-puberty. So the for this question what is displayed, your answer is correct, acidic generally. Okay, but if it is pre-pubertic, your answer is supposed to be neutral. And if it is after menopause, also it is neutral. Okay, if neutral option is not there, then it can be alkaline, near alkaline. Got it? Neutral is around 7 pH. Okay, and what is the reason for this? You said acidic. What is the reason why it is acidic in nature?
due to the presence of borderline bacilli, sir.
Very good. Well, please remember, Doderlin bacilli are the responsible which converts the glycogen and converts into lactic acid. The presence of lactic acid is the key for keeping the vaginal flora as acidic. Okay. Please remember, behind this question, you should know the reproductive age, pre-pubertal age, and menopausal age. Okay, but the answer may be three different answers. Okay, two different answers you will get it. Okay, but for this question it is acidic environment is a correct. But please do remember, for pre-puberty and menopausal, the neutral environment is the correct answer. Hope it is clear to you.
Yes,
Yes.
sir.
But at the same time, if I ask you the same question in another angle, at the time of sexual excitement, what could be the pH of vagina?
Alkaline, sir.
Alkaline, sir.
Alkaline?
Alkaline, sir.
Very good. It will be alkaline because why it is alkaline that time? Why it is alkaline?
Secretion of Bartholomew glands.
Very good. Secretions from the Bartholin glands and the scaneous gland. Remember too. Okay, Bartholin glands as well as a scaneous gland which secretes the alkaline vaginal secretions. Okay, at the time of sexual excitement. Okay, it will become alkaline. Then only the sperms will be sperms will be alive, or it will be penetrating through towards the fallopian tube. Otherwise, this if it is acidic in nature, then the sperm will not survive. Okay, please around this acidic the environment pH, there you can expect a question in the examination also. Okay, hope it is clear to you.
Yes, sir.
Yes, next. Okay, next question is which is the primary organ for reproduction in female? She can guess.
Ovum, sir.
Uh,
Ovary, sir.
yes, any
Ovary.
ovum,
Ovary, sir.
ovary.
Ovary.
Ovary, sir.
Uh,
Ovary, sir.
uh, so one is telling ovary, one is telling ovum. Anyone want to go with Graphian follicle? Anyway, uterus is not in the context. Anybody would like to try? So I have removed one option D, but however we have kept three. You just think one more time, think for another 10 seconds and tell me what is your answer for this question. Which is the primary organ for reproduction in female? I want everyone to read the question in yourself for at least 2 times so that you will come to your answer clearly.
Ovary, sir.
Ovary.
Now you are telling ovary. One who said ovum, whether your answer still same or different?
Uterus.
Different, sir.
Why it is ovary? Why not it is ovum or not for Graphian follicle? Yes, anyone would like to justify?
Organ అని అడిగారు
Yes.
కదా సార్.
వెరీ గుడ్. సి ఆడ క్వశ్చన్ లో ఆర్గన్ అని ఉన్నప్పుడు మనం ఆర్గన్ రాయాలి, అప్పుడు సెల్ రాయకూడదు. ఇఫ్ ద సేమ్ క్వశ్చన్ విచ్ ఇస్ ద ప్రైమరీ సెల్ ఫర్ ద రీప్రొడక్షన్ అని వస్తే ఓవం అవుతుంది మీ ఆన్సర్. గాట్ ఇట్? యాజ్ ద క్వశ్చన్, అందుకే క్వశ్చన్ ని 2 సార్లు చదవాలి అనేది దీనికే. ఎందుకంటే వి కమ్ టు ఏ కంక్లూజన్ ఓవం. వి నో దట్ ఓవం ఇస్ రెస్పాన్సిబుల్ ఫర్ ద ఫర్టిలైజేషన్, రైట్? కానీ ఇప్పుడు ఇక్కడ ఏమడిగారు, ఆర్గన్ అని అడిగినప్పుడు వి షుడ్ స్టిక్ ఆన్ టు ద ఆర్గన్ ఓన్లీ. ఓకే, ద ఆర్గన్ విచ్ రిలీజెస్ ద ovum, that is ovary. Okay, please, here is a trick point. You should be careful, though you know the answer, but you may commit mistake. Okay, so here the ovary, because it is the organ. If the question is asked which is the primary cell, then your answer would be ovum. Okay, hope you understood.
Yes,
Your
sir.
mistake in understanding organ and cell, that's a question is very important. Okay, next is which of the following is the normal position of uterus?
Antiverted and antiflexible.
So antiverted. Oh, sorry, I put the angle. So you guessed it right, right? But remember, antiverted and antiflexed. Sometimes you get confused retroverted and retroflexed. Undachana అనుకోవచ్చు. But you should remember this: antiverted and antiflexed is the answer. But remember the angle, very important. Okay, see, sometimes when the level of examination is high, then they don't ask this basic question, then they will ask the angle. What is the antiverted angle and the antiflexed angle of the uterus? Okay, then you please remember this 90 degrees antiverted, and the angle made between the between the vagina and the uterus is 90 degree, whereas the cervix and the body of the uterus is made 120-degree angle. Okay, that is what you're supposed to remember. Okay, good. The next question. So this is a diagram, just I forgot about it. What's the shape of non-pregnant uterus is?
Pyriform, sir.
Pyriform.
Pyriform. Pyriform.
Pyriform.
Pyriform.
Okay, done. So it is so easy. Pyriform, not oval, not cylinder. Pyriform is like a pear-shaped. Also, we can say it. Pear అంటే ఏమంటారు తెలుగులో ఏమంటారు పంట పేరు pear అంటే లైక్ ఏం పండు అంటారు పియర్ ఇట్స్ లైక్ గోవా వాట్ యు సే ఇన్ తెలుగు
Goa means
జామకాయ సార్.
Jamkai.
ఏది జామకాయ లేక షేప్ ఉంటుంది ఓకే ద బేస్ అండ్ దర్ విల్ బి ట్యూబులర్ స్ట్రక్చర్ దట్ ఈస్ వాట్ ఈస్ కాల్డ్ as a pyriform structure okay remember okay good the next question this is not easy but uterine pacemaker situated at what is this pacemaker so this is also the okay electrical impulses which initiates the contraction of the uterus. It is also by the electrical impulses. Even in uterus also we have a pacemaker. Okay, you can tell which I didn't discuss this. So which is the pacemaker of where the uterine pacemaker is situated at?
Option A, sir.
What is that option? A.
Yes, sir.
Sure. Okay, so it is not isthmus cervix. It's corner of the uterus is the correct answer. Where from there only usually this is we call the tubal oste is other term we use it. Okay, this is a place where the electrical impulses will be generated and which propels the initiation of contraction. Okay, which is triggered by the presence of oxytocin. Okay, so which triggers and please remember this term cornu of the uterus which is otherwise called as the tubal oste is the place where the uterine contraction will be initiated. Okay, that's why it is called as a pacemaker. Okay, fine. The next is what is the normal size of uterus? You just guess
D,
and tell me.
Sir.
option D, sir.
B సార్.
Option B, B, then
D,
D సార్. D
is
సార్.
B,
Last
D.
one.
Why not? Last
D
one.
sir.
Why not A? A?
అది 0.5 ఉంది కదా
Okay. You made that observation. Very good. Uh, if you made the observation, it is a good sign that you are making an effort to see all the options. Okay. This is put because in the exam లో మనకి ఏమనిపిస్తుంది కన్నికి ఫస్ట్ కనిపిస్తుంది కదా యూ ఫీల్ దట్ ఇట్ ఈస్ కరెక్ట్ ప్రింటింగ్ మిస్టేక్ ఉండొచ్చు అనుకుంటారు కానీ ఇట్ ఈస్ పర్పస్ఫుల్ మిస్టేక్ okay so the first option is not the correct one and the D is the right answer okay 0.5 అని కొన్ని దాంట్లో ఇచ్చింది this has been asked in an examination that's why I given this okay please remember and first ఏ ఆప్షన్ కే మీరు ఆగకూడదు ఎప్పుడైనా కానీ క్వశ్చన్ ఎప్పుడు అడిగితేనో don't stick on to the first option you should see all the option then you should confirm okay and here the right answer is the option D where the size of the normal uterus is 7.5 centimeter length 5 breadth and the 2.5 is the diameter okay what is the normal weight of the uterus you can guess
60.
and tell me
sir.
60 okay if it is
50
for
to 80
the
grams.
50 to 80 grams
80
which
normal
one
range sir. 50 to 80.
okay,
Yes sir.
50 to okay so usually if there is a specific term if the range is asked what is the normal range if it is asked please write range to 50 to 80 if it is asked specifically go with the
60.
specific number 60 okay however in case of term mother what is the weight what is the expected mother of a sorry weight of the uterus a term లో ఎంత ఉంటుంది
900 to 1000 grams, sir.
900 to 1000 grams sir.
Very good 900 to 1000 grams good so during pregnancy which muscle layer of the uterus is called as the living ligature
Middle muscle layer, sir.
middle muscle layer okay what is the significance of middle muscle layer?
Crossing.
How it is made up of?
Crossing.
Blood vessels.
Okay, crisscrossing, and these are figure of eight pattern. Figure of eight muscles are there in the middle layer. So that's why it compresses the uterine arteries. Okay, that's why it is called as the living ligature. Please remember middle layer. Again, you should remember crisscrossing as well as the living ligature.
Figure of
Okay.
eight.
Okay, fallopian tube is lined by columnar, epithelium, or germinal. Yes, yes.
వాయిస్ క్లియర్ గా లేదు సార్.
Which
సార్
one?
మీ వాయిస్ బ్రేక్ అవుతుంది.
What is it? Now,
క్వశ్చన్ కూడా డిస్ప్లే అవ్వలేదు సార్.
your question and by of epithelial cells. Is it columnar?
Sir, your voice is breaking, sir.
వాయిస్ అసలు క్లియర్ గా లేదు సార్. సార్ బ్రేక్ అయిపోతుంది సార్.
సార్ మీ వాయిస్ అసలు కంప్లీట్ గా బ్రేక్ అయిపోతుంది సార్. అసలు ఏం వినిపించడం లేదు.
Read by yourself. Yes. Oh, can you hear me now?
Yes, sir.
వినిపిస్తుంది ఎప్పుడు?
ఎస్ సార్.
Yes, sir.
Okay, okay. Now you can answer this, I think, by reading this question. Have you answered this?
కాలమ్నర్ ఎపిథీలియం సార్.
Ciliated సార్.
Sorry, there is some technical problem. Can you hear me now? Okay. Okay. Hope you have said the answer. Ciliated epithelium.
సార్ ఏ ఆన్సర్ సార్?
A.
Ciliated.
Sure.
సార్ సీలియేటెడ్ కాలమ్నార్
Now you can.
ఎపిథీలియం.
No, it is not A. But remember, cilia, presence of cilia is more important because this is the one which is pushing the ovum upside. Got it? Cilias which are helpful in movement of the ovum. Okay, please remember this is an important question. Okay, fallopian tube has ciliated epithelium. Okay, please remember this. It is not columnar, it is ciliated, which is having a cilia which propels the ovum. Okay, fine. Okay, next. So arrange the parts of the fallopian tube from medial to lateral order. Please try to understand this question and then you answer.
సార్ ఏబిసిడి.
Sure, are you sure from is it medial to lateral or lateral to
Yes,
medial?
ABCD.
Okay, hope you understood the concept. It is from middle to the lateral part. Okay, so you mean to say A, B, C, D. A is interstitial, next is isthmus, then ampulla and infundibulum. Okay, fine. I think it is made little easy, right? What you said is right. So this is what is the picture which says interstitial part, then the Isthmus, then the ampulla, then the infundibulum. Okay, good, good. So endometrium of pregnant uterus is known as, this is more
Residue.
simple.
Residue.
Okay. Okay, this is a very
Residue.
straight question. Okay, this is very straight question and easy question. Good. You can able to answer this too. Please read and understand this question. Okay. The phase in which the lining cells of the ovarian follicle are stimulated by luteinizing hormone to develop the corpus luteum to produce progesterone and estrogen is. So in which phase does it happens?
Follicular.
Sir, proliferative phase.
Proliferative phase, bleeding phase, proliferative phase.
Follicular.
Just think one more time. One more time. Just think. So you are just remember this. Where the corpus luteum is there.
Sir, secretory
Okay.
phases, sir.
When the corpus luteum is there and it is producing, sustained producing progesterone and estrogen, then your answer supposed to be from the luteal stage, that is secretory phase. Okay, that is a phase where the progesterone and the estrogen will be continued to produce. Okay, until the progesterone is there, the decidua is not going to shed. Okay, so that's why please remember when the luteinizing hormone is high. Okay, so then the ovulation will take place. From the ovulation, they are mean to say this. There is a corpus luteum. Corpus luteum comes only after the ovulation, right? So after the ovulation, we can't think of proliferative phase. Okay. Even the menstrual phase also we cannot take it. Even the follicular stage is also before the ovulation. Got it? After the ovulation, only among this is secretory phase, okay, which happens after the ovulation. Okay, hope the things are clear. Which hormone triggers the ovulation? Okay, this is already
LH.
I told you. So which hormone?
Luteinizing hormone, sir.
It
LH,
is
sir. B.
it is okay. Answer B. Okay, B is for luteinizing hormone. Okay, so very good. Please remember the upsurge of luteinizing hormone only triggers the ovulation. Okay, very good. The common site of fertilization, which is the common site of fertilization in female reproductive system.
Ampulla, sir.
Okay, you can answer this. This
Ampulla,
is
sir.
already told you. Which
Ampullus.
one? So
Ampullus,
ampulla.
sir.
Okay. Anyone who would like to go for isthmus or infundibulum? Infundibulum?
No, sir.
No,
Ampulla.
sir,
No,
ampulla only.
ampulla. Okay. Please remember this is repeatedly they are asking this question. Please remember this. Ampulla is the right answer. Okay. So this is which is the smallest cell in human?
Sperm, sir.
And
Sperm,
this
sir.
I
Sperm,
already
sir.
told you regarding this.
Sperm.
Yes. Which one?
Sperm, sir.
Sperm.
Okay. Option C is sperm. Okay. This already I told you. Okay. Fine. So which is true regarding the primary oocytes? Okay. Primary oocytes. What is correct in this question? You just tell me. So all primary oocytes are formed in prenatal life. All primary oocytes are formed just after the birth. All primary oocytes are formed after menarche. All primary oocytes are formed just before menstruation. Okay, which one is true in these statements?
Sir, option B.
Pardon?
Prenatal life, sir.
You're making an effort. Answer D.
Yeah, yes, sir.
Answer A. Sure.
Yes, sir.
Okay, answer A is the right answer. Where even before the birth only there will be primary oocytes. Okay, we say that almost 7 billion oocytes will be present before the birth. Okay, so right. So, which enzyme present in the acromial tip of the sperm facilitate the penetration of zona pellucida of ovum?
Option D, sir.
Hyaluronidase.
Yeah. Okay. Hyaluronidase is the right answer. Along with the acrosin is another one which we usually call it as. Okay. Good. Uh, okay. Next, how many number of chromosomes a primary oocyte or a primary spermatocyte contains?
46, sir.
Sir.
46, sir.
Primary, okay, primary always contains 46. Okay, remember it is 46 is the primary. Okay, oocytes will be having 46 chromosomes. Okay, when they become after first meiotic division only, it will be converted into 23. Okay, after the first meiotic division it will become 23, then next meiotic division again it remains 23. Okay, fine. So the next question, the skinny gland is homologous to which one? Which we
Prostate
said about the
glands.
homologous and the analogous?
Prostate.
Yes.
Prostate gland, sir.
Okay. Okay. Remember this. The prostate gland. Please remember the table, especially at the time of examination. Okay. Fine. Prostate gland is the correct answer. So, and the next question is this. I didn't tell you. Not so important, but sometimes they may ask question. So, who is the father of modern gynecology? Though we didn't tell, but however you make an attempt, we'll see. Any
Sir,
guess?
B. B.
B. Anandi Bai Gopalrao
B, sir.
Joshi.
B. Yes, sir.
D. Sushruta. Okay, but not Sushruta. Sushruta is for surgery.
Yes, sir.
Hippocrates for medicine. Anandi Bai is a renowned obstetrician. Okay, but the remaining option A, James Madison Sims, whom they consider as a father of modern gynecology. Okay, this is just an additional information. Somewhere I got it. They didn't ask this, but simply to build some curiosity. Okay. Okay, fine. I think we are finished with the questions. If any doubts, you can ask me. Hope you're able to follow my classes. Hope you're understanding.
Yes, sir.
Yeah.
Yes,
Yes,
Any
sir.
sir.
any modification to be done, you tell me so that I can change
Sir,
accordingly.
No, sir.
sometimes you will speak in Telugu, sir. We will understand
Sometimes I
easily.
should. Okay,
Hmm.
okay, fine, no worry. Okay, next time we will try to improve. Try to include Telugu in between. Okay. Hope any queries, if any questions, so that I can clarify now or tomorrow. If any questions, if not now, also you can message me so that in the next class I will try to tell it in case if you need any little more clarifications. Okay. Okay, fine. Shall we wind up?
Okay, sir.
Thank you, sir.
Okay, sir. Thank you,
Okay,
sir.
then tomorrow. Okay, then. Thank you so much. Tomorrow we'll have class at 7 to 9.
Okay, sir.
Yes, sir.
Okay, sir.
Okay. Okay, I
Thank you,
will
sir.
share the content in the group. You can have a revision also. Yeah.
Thank you, sir.
Okay, then. Thank
Okay,
you
sir.
so
Thank you,
much.
sir. Thank you,
Have a
sir.
nice time. Uh, Good night. Good night. Have a nice dinner. Sleep
Thank
well.
you,
Eat
sir.
well. Thank you.
Night, sir.